Adam DeWitt, cranial nerve examination. The date is 6/21/17. We're going to start off with cranial nerve 1. Go ahead and close one nostril for me. Breathe in and out. And close the other nostril. Breathe in and breathe out. Okay, go ahead and close your eyes and close the first nostril for me again. Deep breath in and out. And close the other nostril for me. Keep your eyes closed. Breathe in and breathe out. You can open your eyes. Did you identify the smell?
Coffee.
And was the intensity of the smell the same on both sides?
Yes.
Awesome. Now we're going to check your eyes with the fundoscope. I'm going to go ahead and have you look up at the picture frame over there for me. And I'm going to be checking the cup to disc ratio and observing for papilledema, AV nicking, or hemorrhaging. Good. Then I'm going to have you look just above the TV over here. And then same thing on this side. I'm going to be looking at the cup to disc ratio, observing for papilledema, AV nicking, or hemorrhaging as well. Good. All right, now I'm going to check your field of vision. So I'm going to go ahead and have you stare right here and cover up one of your eyes with your hand, please. And then I'm going to be holding up with my hand either a 1, a 2, or a 5. Go ahead and tell me what you see.
1, 5, 1, 5, 5, 1.
Good. Go ahead and cover your eye and do the same. Keep looking right here.
1, 5, 5, 1, 1, 5.
Good. All right, you can go ahead and uncover your eyes. Now we're going to check your direct and consensual. Go ahead and look straight ahead for me. I'm going to be shining the light into one eye, and I'm looking for both of the pupils to constrict. If I were to shine the light into the left eye, and both pupils constricted, and then shine the light into the right eye, and neither pupils constrict, then that would be a cranial nerve 2 lesion on the right. And if I were to shine the light into the left eye, and the left pupil constrict and the right pupil did not, and then shine the light into the right eye, and the right pupil still did not constrict, and the left one did constrict, then that would be a cranial nerve 3 lesion on the right as well. Now I'm going to do pupillary fatigue. Keep looking straight ahead for me. And I'm looking for the pupil to constrict and hold. An abnormal finding here would be the pupil not being able to constrict at all, or if it constricted but did not hold, or if we had hippus, which would be oscillations. Right? Keep looking forward for me. I'm going to be looking for ptosis, and close your eyes for me lightly. And I'm checking for blepharospasms. Nope, looks like you're good. All right. Now we're going to check consensual accommodation. Go ahead and keep your eyes focused on my finger. Go ahead and look at the back wall. And back to the finger. Back wall again. And to the finger. And one more time back to the wall. Good. Now I'm going to do the H in space. So once again, keep your head straight and look at my finger. Looking to watch the eyes track evenly. Also observing for saccades and end-stage nystagmus. Good. All right, now we're going to be checking cranial nerve 5. So I'm going to be using this on your face. Go ahead and give me your hand. This is what it's going to feel like. Is that okay?
Yes.
All right, good. Go ahead and tell me, was the intensity the same all the way through?
Yes.
Was the intensity the same all the way through?
Yes.
Was the intensity the same side to side?
Yes.
Intensity the same all the way through?
Yes.
And the intensity the same all the way through?
Yes.
And the intensity same side to side?
Yes.
Intensity the same all the way through?
Yes.
Intensity the same all the way through?
Yes.
And was the intensity the same side to side?
Yes.
Good. Now we're going to do the same thing with the cotton swap. Is the intensity the same all the way through?
Yes.
Is the intensity the same all the way through?
Yes.
And was the intensity the same side to side?
Yes.
Intensity the same all the way through?
Yes.
And is the intensity the same all the way through?
Yes.
Was the intensity the same side to side?
Yes.
Intensity the same all the way through?
Yes.
And intensity the same all the way through?
Yes.
And was the intensity the same side to side?
Yes.
Good. Now we're going to check motor. Go ahead and clench your jaw real tight. And relax. And clench again. And relax. Go ahead and open up your mouth. Nice. Now for cranial nerve 7, go ahead and close your eyes real tight. And lift your eyebrows. Puff up your cheeks. Big smile. And think about when Maya crop dusted us earlier. Awesome. Okay, now we're going to check your hearing. Can you hear this?
Yes.
Tell me when the sound goes away.
No.
Good. Can you hear this? Tell me when the sound goes away.
No.
Good. And if there was an abnormality there, then we would continue with the Weber test. Can you hear this?
Yes.
Does the intensity of the sound the same on both sides?
It's louder on the right.
Okay. So if we have lateralization to the right, and I'm going to continue with the Rene test. Can you hear that?
Yes.
Let me know when it stops.
No.
Can you hear that?
Yes.
Let me know when it stops.
No.
Good. So since AC or air conduction was greater than bone conduction, then we would suggest, or we would be thinking of a sensorineural issue on the left side. If BC or bone conduction was greater than air conduction, then we would think it would be a conduction issue on the right side. So now I'm going to go ahead and have you stand up and come over here. We're going to check your tandem gait. So now you keep your arms at your side, head straight forward, and you're going to walk heel to toe. Good, go ahead and come back. Now we're going to do the exact same thing, except you're going to close your eyes this time. I'm going to be right here in case you wobble a little bit. Good, good. A little bit wobbly. Go ahead and have a seat for me. And go ahead and look straight forward. I'm going to be observing for any resting nystagmus. And you're good. Okay, so now we're going to be checking cranial nerve 12. I'm going to have you open up your mouth. I'm going to be looking for any atrophy or fasciculations, which you don't have. Go ahead and stick your tongue out for me. Good. If there was a cranial nerve 12 lesion, then her tongue would deviate towards the weak side. Then go ahead and I'm going to have you stick your tongue to your cheek. Good. And the other side. Good. Okay, now we're going to do cranial nerve 10, looking at the palate elevation. Go ahead and open your mouth. And repeat after me. Ah.
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 Good. If there's a cranial nerve 10 lesion, if it was a physiologic lesion, then the palate on the weak side would either not elevate or it would not elevate quite as high as it would on the strong side. If there was an ablative lesion, then the weak side would not elevate at all and the uvula would deviate towards the strong side. Now, we're going to check your gag reflex. Sorry about this. Go ahead and open your mouth. Good. One more time. Other side. Awesome. And lastly, we're going to check cranial nerve 11. Go ahead and lift up your shoulders for me and resist me pushing down. Awesome. And go ahead and rotate your head to the left and rotate your head to the right. Good. And that concludes our cranial nerve exam.